I think one of the most interesting plan designs we are seeing for this year in Los Angeles, that is a Medicare Advantage plan, is the new plan from SCAN, which is the SCAN Inspired by Women plan. It is very interesting because it is a plan that focuses specifically on the needs for women. And as a person who loves his mom, who loves his wife, and who loves his grandma, well, that seems like something that could be a good fit for them too, at least for grandma so far. Either way, today we're going to take a look at the 5 things from the SCAN Inspired by Women Medicare Advantage plan available in Los Angeles in 2025. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them this AEP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Also, don't forget to like and subscribe. Over the last couple of years, there's been a wave of folks turning 65 years old and becoming eligible for Medicare at the so-called silver tsunami. But the other interesting side of this is the fact that more and more of the people who are turning 65 years old are proportionally of the fairer sex, that is, women. So you would think there would be far more plans like this SCAN Inspired by Women plan that focuses on the needs specifically of women and healthcare facilities that are women-centric, but you don't. You really don't. So yeah, that's what makes this plan a really cool option for Medicare folks in Los Angeles in 2025. Let's take a look at why. The most noticeable thing to me about this plan, and maybe not the most apparent at first glance, is going to be the maximum out-of-pocket or MOOP cap, which is the most that an enrollee could pay in a year for their healthcare services. So that is for doctor's visits, emergency rooms, co-pays, co-insurances, everything, the whole kit and caboodle, all rolled into one, cannot exceed more than $299 a year on this plan. That's for their healthcare services. And that is low, like so low. I have not seen anything lower this year. Maybe there are, and to be fair, I don't look outside of California, but nah, this is the lowest that I have seen so far, which is good because it means that someone who is enrolled in this plan could set aside, let's say, $300 for the year as a health emergency fund, and that could cover pretty much all their costs. Another thing to notice on this is, I guess, one of the downsides. One of the, I guess I call it downsides of this plan, is the fact that there is a monthly premium of $25 for this plan. This, of course, has to be paid on top of that Medicare Part B cost, which in 2025 will likely, probably, be an estimated $185 a month. Hasn't come out yet, but that's what all the smart money's at. So maybe that is why the maximum out-of-pocket could be so low, because they are recouping some of those costs on the guaranteed monthly payments, the premiums. Also, it must be said, it's pretty not common to have a monthly premium on Medicare Advantage plans, especially these HMO-style plans like this one, but there is one. I guess the other side of this would be if someone does know their healthcare expense will likely exceed $299 a year, then in certain situations, paying the premium may still make sense to get that much lower MOOP. One benefit that I have not seen on any other plan, on this plan, is going to be a yearly reimbursement for weight loss management programs. This is something I will definitely have to dig into a little bit deeper because there isn't a lot of description on it out yet, but it's worth noting because the SCAN Inspired by Women plan does have a $100 annual reimbursement that could be used for weight loss management. The way this works is that once a person chooses a qualified weight loss program and pays the fees, they can submit the receipts to SCAN to get it reimbursed at $100. Now, $100 is not going to be life-changing, but I think it's a valuable assistance towards a benefit that, is very uncommon in the Medicare Advantage arena. So it's kind of interesting and cool, yeah. Now, if we want to move on to other benefits that are not just for women, but are also just pretty good in general, and in fact, are for anybody who has teeth. Actually, you know what? These benefits are also pretty good for people who don't have any teeth. We'll talk about dentures here in a second. Is the dental benefits that come along with the SCAN Inspired by Women plan. Now, one of the things that is not uncommon, but is definitely not common just yet on Medicare Advantage plans, at least here in Southern California, is to have a automatically included comprehensive dental benefit available, standard, stock, by default. More often than not, there is a very limited basic dental that covers things like fluoride, basic superficial annual cleanings and x-rays, just kind of run-of-the-mill day-to-day stuff, but will exclude more expensive, more complex kind of procedures that a lot of folks need by the time they get to Medicare. But on the Scan Inspired by Women plan, it automatically includes comprehensive dental that, of course, covers the cleanings and x-rays, but also includes things like restorative services, root canals, and even dentures with no annual limit to the cost on those services, at least on the standard HMO default dental plan setting. Additionally, if someone would want to change over their comprehensive dental to one that is also a PPO style plan for dental, meaning that they will have much more access to dentists, those benefits are still available, but they are going to be limited at $2,000 for the years that the plan will pay on behalf of the beneficiary for those dental services. That's on the PPO version only. So any cost over $2,000 worth of allowance would have to be paid by the beneficiary, but that is just on the PPO dental plan, and that's kind of the way PPO dental goes. I don't know how to say it that way. Moving from the teeth to the ears, let's talk about hearing benefits available on the Scan Inspired by Women plan, because there are basically two ways plans will cover hearing aids typically. There are either a set allowance that the beneficiary can use in a specific time period, 12, 24, 36 months, or a copay, which is a set cost that a beneficiary will pay within that same set time period. On this plan, there is a hearing allowance that is going to start at $450 up to $750 per hearing aid per year. So that's every 12 months. Now, this is a nice benefit because they do the hearing aids by ear and not just you have to get two at a time. And also the time frame is pretty good at that 12 months because 12 months is considerably better than 36 months, which I think is the longest I've seen so far. And that's a long time to go if you lose or swallow or break one of your hearing aids, and all those things I've definitely heard. So 12 months, not too bad, and is available on this Scan plan. Either way, hearing aids are super important for folks' mental and physical health, and it's a great benefit to have on this plan. All right, so there you have it, the Scan Inspired by Women plan that actually I don't think you have to be a woman to be enrolled in. I think anyone is able to enroll in it. And maybe it's sort of like, my wife's razors. Sure, they're designed for her, but the physics still kind of works the same for me too. And for some odd reason, they are twice as expensive. I don't know, maybe because they're pink. Anyways, the Scan Inspired plan has some great benefits, but I think they will have to be weighed out against the monthly premium and the specific benefits that someone would actually use on this plan to see if it's going to be a good fit for their Medicare option in Los Angeles in 2025. So that is it for today's Michael's Medicare. And if you or somebody you know is looking at their Medicare options for this year in Southern California and they have questions, please feel free to reach out to us at the information down below and we can help them navigate through those tough Medicare questions over the phone or in person at one of our many offices across Southern California in English or Espanol. Also, don't forget to like and subscribe so you can get updates when our newest Medicare content comes out every single week and doubled up during AEP. So for Michael's Medicare, I of course am Michael, hoping you have a great rest of your day and goodbye.